you're good right there. We're just gonna put this on your left bicep here. You're flexing for the camera?
Yep. It's not my good side, but I'm just kidding.
Well, we'll kind of rock and roll here. We'll do like a little kind of consultation, do a couple little tests on you, take some x-rays, and then get you adjusted.
Cool.
All right. Have you been adjusted before?
It's been a while, but yes, I have.
What's a while?
When I first started CrossFit, like 7 years ago, I think.
Okay, so a long while.
Yeah, it's been a while.
I got you. So I know you were talking about that right knee. That was kind of a new, recent injury.
Mm-hmm.
But you're also talking about some upper back discomfort, some tightness in there.
Mm-hmm.
Is it just right between the shoulder blades? Does it favor a side at all?
No, they're both pretty prevalent. I would say they're like almost the same. They're just super tight.
Okay. It's more just like the shoulder
Yep,
blades.
shoulder blades.
Okay, so nothing like in between?
Some like my rotation isn't great. So like
Okay.
in here, but not like the
I
traps
think I
or
heard a
anything.
little bit of clicking in
Yep.
there too.
Mm-hmm.
Okay. You played softball too?
I did, yeah.
Okay.
Through college.
So what position?
I grew up playing shortstop,
Okay.
and in college
That's
I
fine.
played second, and now when I play slow pitch, I play outfield. So
Gotcha.
a
All
little bit
right.
of a different throw now.
Yeah, so you definitely know how to whip that ball for sure.
I try.
Try to? Yeah, that's tricky. I mean, that is just, our shoulders are pretty amazing joints because it's like a big ball, meaning a small little cup, right?
Right.
So I like using the analogy that it's like a big golf ball, meaning a golf tee. So that's like essentially the cup that it looks like in there.
Right.
But we have 4 specific rotator cuff muscles that are strong enough to actually hold that ball in the cup.
Okay.
So it does allow strength and a lot of range of motion, but unfortunately it's so easy to wear that down and break that down because those rotator cuff muscles can endure a lot of stress, but as soon as they start scarring up, you get those clicking, popping, and then all of a sudden it leads to like frozen shoulder down the road, and we don't want that to happen.
Yeah. I
So
like
it's
in
a little
CrossFit
tricky.
I won't even, so I do bar muscle ups, but I don't string them right now because I don't have that like range of motion
Okay.
enough, because like I can do one at a time, but when you come back down you're supposed to like come all the way through, and I like both mine don't, I just like can't get that, so I just like it's not worth it to hurt myself and do it. So
Yeah, that's a little tricky, and it's all it takes is that one
I'm like, I'm good.
one little excessive push through range of motion.
Exactly.
That's all it takes. But
Not worth it.
do you get pain like going down the arms at all or anything like that? Okay. All right. So you mainly feel that if you're doing anything overhead. So like lifting, is that correct?
Lifting, and then like I would say some of the gymnastic movements, like the pull-ups and like bar muscle-ups, that would be considered lifting,
Okay.
I guess.
Yeah, so like even doing pull-ups
Yeah.
and things like that.
Just tight.
You don't have any like issues while you're sitting too long, standing too long, poor posture doesn't like aggravate you or anything like that? Okay. I gotcha. And what do you do that seems to help it? You do anything with like ice, heat, massage, stretch?
I can't ice because it gives me hives.
Really?
Yeah.
Uh-oh.
So my body is
Okay.
a mess, but yes. No, just stretching, kind of.
Okay. Just trying to like get the range of
Movement,
motion
yeah.
going a little bit.
Probably should
Yeah.
do more of it.
The ice causes?
Yeah, isn't that
Too?
crazy?
That
It
is-
just started happening like 5 years ago.
Really?
So if I put like a
Like you put any ice on your knee or anything?
I put like I double wrapped a towel around it so it's like cool compress, but I can't put like cold on it because it like blows up.
Really? That is really interesting.
I know, I looked it up. It's called cold urticaria. It's like a real thing.
Oh, okay.
That's not weird.
Look at that, you're teaching me. That's really interesting. Like I'm a huge advocate for ice in general.
Yeah.
Just because, again, decreasing inflammation. You're also like desensitizing injuries and things like that. But you're also like, if you do like the cold plunges, polar plunges, it increases your sympathetic threshold.
Yeah, I used to
So it
like when
helps
I was
a
in
lot.
college. I did like ice baths all the time, like with my legs and stuff, knees, ankles, like whatever. And
And you still,
I was fine then. And like
Oh, really?
ever since I moved here, like 5
you
years
said it
ago.
was 14 when you had.
Yeah. So like the cold hives haven't started until I moved here. So I've just become acclimated to being an Arizonian.
Okay. Well, you're in the right place to avoid the
I
ice. That's for
know.
sure. I think it was like
So crazy.
It was probably like one of the coldest weeks was this week, and
That wasn't that bad.
No, not at all. It was perfect. Like high of 80s and low of what, like 35. So on a pain scale, 0 to 10, 10 being the worst, when your shoulders do kind of flare up?
4 or 5.
Okay.
Nothing
So
too bad
it's just enough to kind of like annoy you, but it's not. Okay.
Yep.
And it's not there 24/7. It's more like if you're specifically doing overhead lifts, stressing with shoulders.
For sure.
Gotcha. And then that right knee. Let's dive into that.
Okay.
First of all, when did you experience the pain?
Monday.
It was Monday? Okay, so literally just 5 days ago. Okay. And again, you feel it more on the inside of the knee?
Yeah, right here.
Okay, so it's on the inside of like the patella more?
I don't know.
Okay, here, just relax your knee for a second here. So again, it's not like tender through here? Okay. It's more...
Right, yep,
okay.
in there.
I gotcha. Alright.
That's tight too.
Is that not as tight as this?
Mm-hmm.
A little
It's
crunchiness. Okay.
That might be similar over here too, but I'm not sure.
Okay. So again, if I poke in here,
No.
that doesn't hurt?
No.
Okay. I'm going to find some tender spots, obviously, poking around in here, because again, quads coming over the patella, they all attach to the tibial tuberosity right here.
Okay.
Makes it, the patella gives it like a nice little fulcrum, so you get a lot of strength with the extension and everything. That's why legs are really strong that way. But I'll do a couple little tests and see what's going on in there.
Okay.
When you're talking about that medial aspect in there, you can feel how tight it is.
Yeah.
Again, what really happens with like a lot of avid runners, hikers, you know, little things like that, you get something called patellar femoral syndrome. It sounds way worse than it is, I promise.
Okay.
But all it is that the patella doesn't quite want to track properly over the kneecap.
Okay.
Or it tracks like too much and it creates scar tissue underneath. So you do get that clicking, popping, especially when that thing wants to move around. So it's common. We do see it more, like it feels like it's right underneath the kneecap a lot. But typically, I know you were saying like you're really strong in the adductors.
Well, yeah, like all in here is like tight. It's like super tight. So I feel like since my hips are so tight, when I like try to stretch, like when I try to do like the couch stretch now, or if I like do like the butterfly stretch, it's so tight and I can feel it into my knees.
Okay. It's something to try to get in a healthy habit of trying to stretch that on a regular basis. I mean, do you?
Yeah, but it just recently happened like within the last year. It never used to be that tight.
Okay, and you were sitting cross-legged, something like this?
Can I do that? Is that
no,
what you're saying?
did you do that? And is that when you felt like the clicking after you did that?
No, I was like literally sitting on the ground like crossed like this, and I pushed up out of it like that. And when I pushed like this right here clicked.
Clicked, okay. And it was really painful?
Yeah.
I gotcha. So again, that does happen a lot with that patellar femoral syndrome.
Okay.
There's also chondromalacia that builds under there, so it's essentially just a buildup of scar tissue under there.
Okay.
But when you get that one big crack, that's actually typically you breaking up scar tissue in there. Hurts like hell, but it's actually technically a good thing.
Feels good.
Right?
Well, technically should feel better later.
Yeah, should. After you get through that inflammatory response. But so that one little click was sharp, but have you had any like sharp pain since then?
Yeah, it definitely hurts more when I'm like walking or standing, which I do often.
Okay.
At work.
It doesn't like throb or anything like that?
It was throbbing. It throbs when I'm driving, which is kind of weird.
Everything is with the pedals. For most people at least, it should be right-footed. Yeah. So we do see like a lot of extension pushing with that, so we do see like right-sided issues with that sometimes. But yeah, the driving I wouldn't really assume would injure that too much, but yeah, we'll...
It definitely hurt. Like since it happened on Monday, I noticed it while I'm driving.
Just while you're driving, huh?
And walking.
Okay. Have you done anything that seems to help it?
I've iced it.
Did it help though?
It made it feel a little better.
Okay. No medications, no specific stretches,
a
anything
leaf,
like that?
and I've been putting CBD oil on it.
Okay. All right.
I don't know how helpful it's been, but
that kind of stuff does help.
Yeah.
Again, cannabinoids, they do, they kind of fill in like pain receptors, so they can be very beneficial. That's why CBD is such a hot commodity right now. Yeah. It's just not well researched, and the quality of the CBD is hard to know where you're getting it. But I actually have some pretty good CBD stuff that, for you in the joint, it would be more, it's like a lotion.
Yeah, that's kind of like what this one is. It's not like I don't
It's
know
like a
what
balm or something?
It's not a balm. I do have a balm too, but I haven't used that one. It's like more of a lotion that I've been using.
Okay. Yeah, this one's like a deodorant stick, but it leaves like a lotiony residue on it, and it's got arnica and turmeric in it, so both anti-inflammatory. Tends to be more beneficial with joints. And I do have like a roll-on one that has methanol in it, so it's like an icy hot with CBD.
I think this one has that because like afterwards, after I put it on, it feels like cold.
Cool.
Yeah.
It's probably like that methanol in there then. So I like using that kind of stuff more for soft tissue.
Okay.
The arnica, turmeric, the lotion type of stuff is actually gonna like be absorbed in the skin better and gonna get into the joint a little better. So that tends to help with that a little bit. But when your knee was flared up, 0 to 10, 10 being the worst pain ever, where did it kind of fall in there?
7.
7-ish? Okay. All right. Any general medical conditions I should know about?
Other than the Lyme disease, not really.
All right. Yeah, I'll make note of that. But any like blood clots, arthritis, anxiety, anemias, thyroid issues, anything?
I think everybody has anxiety, but no.
Yeah, it's kind of normal.
I think everybody has that, but yeah.
Any current medications I should know about?
Just birth control.
Okay. And then any surgeries?
Nope.
Shoulders, elbows, wrists, knees, fingers, anything at all? None?
Just.
Knock on wood?
Just my wisdom teeth, that's it.
Okay, fair enough. All right, so we'll do some quick vitals, then I'll do a couple little tests for that knee. So, you're good right there. We're just gonna put this on your left bicep here. You're flexing for the camera?
Yep. It's not my good side, but I'm just kidding. It's the one without the high. So I guess right now it is the good side.
Got that Photoshop. Alright. Just sit nice and still. So 136 over 77. Still really good.
I don't know what that means.
So the textbook normal is like 120 over 80. The top number can fluctuate quite a bit, especially if you know, like have coffee, or if I'm asking a million questions or stressing you out or something, that should fluctuate more. But we want to make sure the bottom one is actually right around that 80. You're at 77, so that's perfect.
Cool.
Easy peasy. And then what's your height and weight?
Oh, I haven't weighed myself well. 5'8" and a half.
Oh, I don't put it in half.
Come on. And like 150.
Okay.
148 on a good day.
Yeah, those are good days. I'll do a little grip strength here too, okay? So, yeah, don't break my machine here, but
I will not.
you're just gonna keep your elbow at 90. You're gonna squeeze as hard as you can, okay? The thing doesn't move, so it kind of feels goofy, but squeeze as hard as you can. Good, and relax. And one more time, as hard as you can, exhale. Good, and you can relax. Same thing on this side, as hard as you can. Good, and relax. One more time, as hard as you can. Good. All right. Pretty good overall. You were just shy of 40 on the left and then just over 40 on the right. So, not bad by any means.
I don't know, what's a normal grip strength?
Well, we don't really look at the overall strength. What we're looking at is symmetry.
Oh, so
for the most part.
Same.
Yeah,
Gotcha.
so if there's a big discrepancy from side to side,
Gotcha.
there's some kind of neuromuscular issue going on. Obviously, your brain's not communicating with the muscles of your arm, so you begin to atrophy, lose that grip strength. Wouldn't really expect that with you today, but
If something like in the shoulders or like the neck or something is like tweaked.
Exactly. All right, well, we'll do a little bit of spinal range of motion here real quick just to kind of see what's going on. But stand nice and normal for me.
Stand?
Yep, stand up for a second. I'm just gonna have you kind of bend to the left. Good. Anything tight in your low back at all? I know your low back doesn't really bug you. No main
It's a little
complaints in there.
tight, but I did power snatch dumbbell.
A little freebie in there. Was that your knee?
That was my hip.
That was your hip? Oh, jeez. Okay. It feels okay though?
Yeah.
And if you extend backwards, does that irritate your low back?
Doesn't really. Just a little tight from power snatches.
Okay.
Dumbbell power snatches.
What if you bend forward like you're tying your shoes or something like that? Does that
like
irritate?
This?
Yep.
No.
Anything down low?
Mm-mm.
Okay. Go back to center. Have a seat for me. I'm gonna have you just tuck your chin to your chest like you're looking down. Does that pull through here? Anything down between the shoulder blades? Anything coming to the shoulders?
Just here.
Down low through here?
Mm-hmm.
Okay. Look up at the ceiling best you can. Does that pinch in your neck at all?
Mm-hmm.
Okay. Back to center. Turn your head as far as you can to the left. Good, and then to the right. All right, not bad. Come back to center. We're gonna go right ear to right shoulder. So you're gonna come this way. There you go. Does that pull on the left? Does it feel tight on the right?
Tight on this side.
Okay. What if you go the other way? A little freebie in there?
Yeah.
I heard that.
It's a little tight.
All right. So just a little tightness in here, huh?
Mm-hmm.
Move your hair a little bit. It's fine. Okay.
Wait.
Yeah. Find a couple tight spots in there.
Mm-hmm.
Okay. If I poke in the front here, does that irritate anything?
Mm-hmm.
Nothing right here? Feels a little tight in there.
It's tight, but it's not like irritating.
Okay.
If that makes sense.
Yeah.
Oh, I have scoliosis. Did I forget to mention that?
Yeah, you did.
Sorry.
But that's okay. See, that's why we take the x-rays. So we
Okay.
can see that stuff anyways.
It's definitely, I have scoliosis. Goes.
To the right?
Yep.
Yeah, I can
Right.
kind of,
Yep, right there.
I can feel that a little bit.
Mm-hmm.
Doesn't feel too bad, but yeah, the right side is definitely more prominent,
Yeah.
which typically means that it curves to the right and actually gets a little rotation like that,
Mm-hmm.
and the ribs like to pop backwards. So we'll see the severity with the x-rays and everything too,
Okay.
but it doesn't seem like it's too bad. A lot of people kind of overdiagnose the scoliosis.
Yeah.
Because by definition, it is lateral curvatures in the
Mhm.
spine, but you know,
They were like,
it's-
you're gonna need to wear a brace. When I was in middle school, I was like, no, I have braces already. You think I'm gonna put on an actual body brace and go to school in middle school? You're out of your mind.
So for a body brace like that, it would have to be pretty significant. So we'll take x-rays and take a peek at it, but again, the scoliosis is not a...
Scoliosis. I did dislocate my hip when I was in like.
Oh, and now it's coming all... It's all coming out
Well,
right now.
that was like years ago, and I went to the chiropractor like in when was that? High school.
So you actually dislocated, like, fully.
Yeah, like when I was playing softball, and I like literally it just like popped itself back in, and then he like just like fixed it. Like my
Okay.
whole body, like it was all the way into my jaw, like everything hurt. And I was like, why?
Really?
I was like, why is my whole body hurt? He was like, oh, because your hip is like not, like you're dislocated. It's like not in there right. I was like, okay. I don't know.
Wow, okay, so you just kind of like felt like a pop and then went right back in type of thing?
Yeah, and I just
Okay,
like
was
had.
it just a big like cavitation? Or
It was
did
just
actually
like painful all the way through. Just it was like
Okay.
pain in my like back here and then up my back.
Gotcha, so
like-
it wasn't actually pain in the front
Mhm.
or anything, it was just in the back.
Yeah, and my coach wouldn't let me sit. He was like, you have to keep playing. And I was like, I was like in tears. He's like, you
Oh,
have to
jeez.
play. And I was like, okay.
So, was it more, does it sound like it was an SI joint? Because I know a lot of people, when you point back here, it's typically like the SI joint, so it's where your sacrum, like your tailbone,
Yeah.
essentially meets your pelvis. There's a big joint there, and if you get some play in there, that can be very painful as well, really irritate that glute.
Okay.
Typically, the hip pain is going to be in the front
Front.
here, but if I can still kind of pull and reset that
Yeah.
hip. So obviously you didn't have any like surgery done for it or
Mhm.
anything like that. That's when you were
Yeah.
seeing the chiro.
Yeah.
Okay.
So he like readjusted.
Okay. Yeah. Typically you want to get that. You want to get that SI joint kind of back in position. But if it's hypermobile like that, you
Yeah.
might want to address it slightly different. But it was on that right side.
Yeah.
Okay. All right. Now it's all coming out.
Like these are all the things I should have said.
Probably.
You have nothing wrong with your nose. Scoliosis, poplars, hips, blah, blah, blah. Oops.
All right. I'm gonna have you just lay on your back for a second so you can take a look at that knee. So just like that is fine. Okay. Get a little crunch in there. Was that your legging?
No, that was the crunch.
There was a crunch in there
Oh,
too.
okay.
Okay. So same thing here. I'm just gonna try to hyperflex it as much as possible. Is that irritated at all?
Mm-mm.
Okay, good. All right. And if I hyperextend it a little bit, does that irritate it? Okay. If I give it like a little bounce like that, nothing.
Mm-mm.
Okay.
feel my Baker's cyst?
I didn't feel it back there, no.
Okay, good. That means it's gone down.
That's good. So now we just found something else out about you. You got Baker's cyst back there. Yeah, definitely don't feel that. Okay.
Yep.
Yeah, I can definitely feel like there's swelling in there, kind of that crunchiness. You can definitely feel that you're like pushing a little bit of fluid, so it's really like spongy. That makes sense. But okay, I'm gonna kind of push on your kneecap here. You might get a little bit of crunching, so you kind of feel that crunch. Yeah, is that tender? Yeah. So that's called Clark's test, and that's literally for patellofemoral syndrome. When I put pressure down like that, I'm literally putting pressure on that scar tissue, and you're feeling that kind of crunch. So what I want you to do is slowly flex your quad here as I put pressure down. So I'll give you kind of a command when to flex it, but go ahead and flex nice and slow. Is that tender?
Yeah.
Yeah. Okay, I can tell you're a little guarded with that. We're gonna do something kind of goofy. I'm gonna have you do this same test on me.
Okay.
But yeah, you feel that?
Yeah.
Are you able to flex your quad? Does that feel like it's gonna hurt?
Yeah. Well, the other one actually hurt a little bit more.
Did it?
Yeah.
You're still kind of guarded there, but you definitely still feel that little crunch.
Yeah, right there.
Yeah. Do you feel on the inside that same thing, or is it just underneath the kneecap?
Just under the kneecap.
Okay. Okay. I still think it's going to be that kind of patellofemoral syndrome, but the fact that it's favoring this medial side is kind of
like
interesting.
when it popped, it was like right in like where your fingers are is like
Yeah.
right under there is where it like popped or like snapped is kind of what it felt like.
Okay. Yeah, I wonder if maybe there was like a little stress or like a little like tear or something in that medial tendon. But here, I'm gonna pull this up a little bit, just take a look at it. Was there any discoloration with it or anything along those lines?
It was definitely bruised on Tuesday, and then the hive was there too. But
Okay. Yeah, you still got some sponginess here, but you can definitely tell that there's a lot more swelling on this right side. And again, like if you are stressing that scar tissue underneath and you kind of re-tear it up, you can develop that inflammation underneath the kneecap. So, yeah, it's kind of tricky. I don't know if this is like if this is necessarily a big candidate for getting the MRI. If anything, we'd want to see, the MRI would still tell you how much scar tissue is underneath that kneecap.
yeah,
It's just we're going to be looking like at the inside of the knee. So we're going to
Yeah.
be evaluating MCL, LCL, meniscus, ACL, PCL, all those.
like but that it would be worth it to look at all of it.
So it never hurts
Yeah.
to look at it, obviously, but yeah, it's kind of hard for me to write that script and everything.
Yeah, no, that's okay.
But-
I'm gonna go see PT also, and he's gonna like kind of do some stuff, I guess. I don't know.
Okay.
I don't know.
Just do some stuff.
Just do some stuff, you
Yeah, I
know.
want to bring you up. Yeah, that'd be the best thing. You almost want to pretend like you're saddling up on a horse or something. Because, you know, there's obviously a lot of different ones like... Oh, God. Let's go take some pictures.
Just like that.
We're going to the Buffalo Chip. $40, you can go ride a bull.
Oh, I'm good.
No?
I don't know the ride bull. Oh my gosh, my knee just popped. The other one.
So again, like, that little popping is okay, but that just means that there's a lot of scar tissue.
Okay.
Kind of.
I mean, it feels good when they pop. It feels like it's like releasing.
Yep, exactly. So that's why even when I do that little Clark's test on you, it hurts, right? It's tender at first,
Yeah.
but you got a really hard name to spell, you know that?
I'm sorry. It's fairly long. It's 9 letters. And the last name is confusing too.
Yeah. So this thing right here is called the bucky. You can use this as a point of reference. Okay? So we'll start with your butt up against the bucky. We'll take 2 pictures of your low back here. I'm going to try to get, I'm going to see if I can actually get your hip in there, but let's see how much of that scoliosis I can get. I might want to just take your thoracic fingers too. Alright. That looks good. So you can put your hands to your side to stand nice and normal. Alright, looking straight ahead.
How do I stand normal if I'm not normal?
Define normal.
Define what you mean by normal.
Nice and still for a second. There you go. Yeah, I don't know whose definition of normal is normal.
It's definitely not normal.
Yeah.
Alright. We got the hips in there.
Are they off? Are they like this?
We'll look at them. Patience.
Rough.
Face towards the wall for me, and your right hip's going to touch the bucky. And what I need you to do is actually bring your arms up kind of like this. You can rest them right on top. And that is perfect position. Just keep that right hip barely touching, alright?
I feel like Houdini.
Nice and still. Yeah, you trying to like break out of some kind of restraint or something? It's like a magic escape.
Yeah.
I'm not that bad, am I?
Meh.
No. Meh.
Eh.
Stay like that for a second here. I'm just going to take pictures of your thoracic too, see where that scoliosis is at.
Okay.
I'm going to have you kind of come to your left a little bit so this can come up past your
This
shoulder.
way?
Yeah, so now put your right shoulder up against this. Still want you square to the wall, so just face the wall. There you go. I'm just going to slide down a tiny bit. Alright, that's good. Your arms are going to stay up like that. That is perfect. For this one, I'm going to kind of start this thing up. You're going to take a nice deep breath in, hold it, and that's when I'm going to take a picture.
Okay.
Okay.
I guess tell me when to breathe.
Okay. I can do that.
Okay.
Just tap.
Did you hear it?
Was that it?
That was it.
That was your knee again?
Yup. But that felt good.
Like a relief?
That was like
That's-
a release.
You're going to have more pressure in there too because of the swelling. So you might get more cracks and pops, but that's actually a good thing.
Yeah.
Right? Like we want to keep things moving. I don't want you to think like I'm a crack addict or something, but like
You like crack?
cracking is good. Dude, that's why people think I'm a crack addict. No, it's
It's a
You-
good thing your
when
name is
you-
not the crack guy.
you want to we want to adjust people. We got the bystanders shaking their head over here. So like when you hear the cracking though, it's important that we're adjusting the joint in the line of the juxtaposition of the joint. Because if we're getting it moving in the right direction and getting that cracking,
Yeah.
that's what's awesome. But when it comes to like people like cracking their fingers
Oh my god, I
or
do
whatever,
that
so again, you don't want to do it like that.
No, I
You don't want to pop them down. You don't want to go side to side because that's not the normal range of motion or like joint position. You want to pull them because you can separate them like this as much as you want. As soon as you start going any other direction, that's when you start shearing
Like
the
this?
joints. Yeah, you don't want to do that because that's specifically is jamming them.
I do that all the time.
Mine just cracked by doing it by accident, but yeah. All right, we're gonna go over these real quick.
Okay.
So this is that front to back picture of your low back. So I'm gonna have you stand up here. I'm gonna bring this up and get you all kind of situated here.
Already cracking.
I'll work on those hips, those ankles, and your knee even too. So you're gonna go actually face down to start. Hold this up quite a bit. I can actually take your glasses and put them over here.
Can't see.
Alright, it's okay. You don't have to see for this. You just gotta stare into the paper.
Okay.
Alright. There are little handles right here.
Oh, please.
Alright.
Okay.
Yep. So here you're coming down.
Got it.
It's like a fun little circus ride since we were talking about the circus. Yeah, so quite a bit short on this right side.
Oh, that's good.
Might be because you're compensating for that knee, but most likely
The left
it's been
one's
going.
usually the one that hurts though. Oh god.
Okay, well that kind of is that tender?
Yeah, it's so tight.
Do we need like a safe word or something?
No, it's okay.
So
Safe word.
again, typically when that leg is short like that, it rocks the pelvis essentially backwards, so it looks like it's coming this way.
Yeah.
Pulls the acetabulum, your hip joint, up.
Asa who?
Acetabulum.
Oh my god.
I'm not calling you names, I promise.
I can't even say that word.
So again, what we're going to want to do is adjust this SI joint
Yeah, it's
here.
so tight right there.
Yeah. If I come on this side, is that still tender?
A little, but not as much as the other
Not
side.
as that. Okay. So again, when I'm coming in here, this is the glute medius and piriformis, and when that gets tight, it gets tight because there's dysfunction in that SI joint. It's pretty straightforward there.
Okay.
Still gonna try to loosen it up a little bit here. Okay. Keep breathing. Good. So from the chiropractor, remember getting all those cracks and pops and all that good stuff?
Yeah.
Alright. All the good stuff. Again, that's just gas being released, so nothing's actually cracking or breaking or anything like that. Okay. Yeah. I'm kind of traction out these ribs a little bit here. Good. So keep breathing, you're doing great.
Thanks.
I'm gonna lean on you here a little bit, alright? You're gonna feel that little crack. There you go.
Oh, fuck.
That was awesome. That was really good.
Okay.
Okay, I'm gonna address this a little differently. There we go. So this one's gonna be a little deeper. Let all that air out. Good job. Relax, relax in here. One more. Okay. It's quite a bit tighter in there. Yeah, we definitely gotta try to get some extension in through that mid back here. I'm gonna use this thing called an activator, okay? Just a little spring-loaded device.
Oh yeah, I know these things. I remember these.
So again,
It feels like a pop, right?
a little bit.
Yeah.
So it's just like that little punch.
This is what I use when I like put my head back in.
Oh, really?
Yeah.
So this is a really good tool because it's a less invasive way of getting things to move.
Yeah.
For you, I'm just trying to get everything mobilized in that upper back because that is really tight in there.
Okay.
So eventually we will get that moving. But since you haven't been adjusted in 8+ years,
It's a
we
little
can't really
tight.
conquer Rome in one visit. But
My right eye is tearing.
okay, we're gonna do one more in here. So let everything just keep relaxing. There you go. I'm gonna kind of traction out your head a little bit, okay? So let everything just melt best you can in here. There you go. That was perfect.
Ugh.
How did that feel?
I don't know. Good, I guess.
You gotta say good things because you're on camera.
It felt
No.
so great.
So again, that's the first rib in there. So you can feel how tight everything was, especially underneath the shoulder blade. I'm gonna still see if I can get that to move, but slightly different. Okay, so I'm gonna come down a little further, do the same thing on this side, okay? Getting that CT junction to move. Just try to melt. There you go. Actually moved on its own. That's
I was
really
gonna
good.
say, I feel like it did before you even moved it.
Yep, that was perfect. All right.
I got
Couple-
sweaty palms.
It is warm in here. Okay, so I'm gonna kind of poke around your knee since you're face down. Work on your knee a little bit here. Okay, so all this feels pretty good.
Yeah.
I'm gonna poke around. That's not too tender.
It's tight. That's not great.
Okay, that's all right. Most of the time, if I'm poking back there, people are like trying to donkey kick me or something. So it's good.
Oof.
Yeah, a little more tight.
Ugh. Yeah.
Okay. Just gonna use the activator, kind of get that fibular head moving, and then work on that popliteal tendon a little bit. A little more tender when I use this thing, huh?
Yeah.
All right. Obviously, that left side's not as bad, right?
No.
Good. All right. I'm gonna have you lay on this left side, face towards the computer. Do you remember the chiro adjusting you this way?
No.
Kind of twisting you up like a pretzel a little bit? Okay. So this is how you actually adjust that SI joint in your low back.
Okay.
All right. You don't have to remember how to do this. You get to just relax, okay? I'm gonna kind of twist you like a pretzel, but I'm gonna roll you towards me. You might feel like you're gonna fall off the table. I promise you won't.
Okay.
All right?
Is this like a trust act?
A little bit. A little bit. Like a trust fall.
Yeah.
You're not gonna fall, okay? So I'm gonna adjust this SI joint. You're gonna get a nice little thud in here. Let all that air out. Good job. That was actually good. Go on the other side. Yeah, you're moving.
Pretty easily?
Yeah, that's good. Alright. Now remember that little left-sided curvature in your lumbars,
Mm-hmm.
your low back? So I'm gonna come up a little higher
Okay.
and try to influence that kind of.
Oh, that's tight.
Yeah. So, pretty tender?
Yeah.
You're like, that was like an alligator bite. Don't get too close here. Same thing over here.
Oh my god.
That was really good.
That was a lot.
Here, go on your back for me. That was perfect.
I'm sweaty.
You can still hear your knees cracking. There's a lot going on
I
there.
know. Why? Help.
I'm gonna work on you. Again, the biggest thing with how your patella tracks is working on the quads. Typically it's the lateral quads, but in your case it's more the medial.
Okay.
So, yeah, I'm still gonna see if we can get these upper ribs moving. So you can feel how tender that is.
Mm-hmm.
So, okay. I'm gonna come through your armpit here, okay? Just let everything just melt right on my hand. Let everything just relax.
Oh.
Yeah, still really tight. Man,
Does not feel good.
that upper back is really tight. Yeah, and again, like the more, even though we don't get like that snap, crackle, and pop in there, it's still influencing the joint to go in the right direction.
Yeah.
So a lot of people like to judge me based off of how much noise I make. And if that's the case, I could just like, whip out some bubble wrap or something. But it's not always about the noise. Some good gratification with the noise, but okay. So you can feel how tight it is down low. So you're gonna feel some more of those pops in there, okay?
Okay.
These are gonna be a little louder. It's
Oh,
only
God.
it's only because they're closer to your ear.
Got it.
Okay? So try to melt the best you can in here.
Oh my god.
That was perfect. That was really good. So again, the lower part of your neck are all the nerves that actually innervate the shoulder and the arm. So if we can keep that moving, then obviously it's just going to help the trap, elevate your scap, everything underneath that scapula that's kind of giving you a hard time. You can feel how tight that is on the left there. Do you ever get like headaches or anything?
Not terrible.
No? Okay. Good. So one more, up a little higher. Let me take the whole weight of your head here. There you go. Just let everything melt.
Oh my god.
Perfect.
Oh my god.
So that other chiropractor ever do that?
I don't remember.
Okay. So that other chiropractor didn't do all the snap, crackles, and pops.
There was definitely some. Like, he definitely readjusted me. But then, like, when I would come back, I think I did, like, a clean and jerk wrong. So we were just doing, like, my shoulder stuff. But he, like,
Okay.
my hips were on a line. My, like, ankles, like, everything was off. So he, like, just, like, readjusted.
Okay. But he used that activator quite a bit more?
Mm-hmm.
I gotcha. Well, we want to get things physically moving, but the activator is a good, less invasive way.
Okay.
So, when things don't want to move and like when it's tender, when I try to like adjust that upper back,
Yeah.
that's a good instance to use that activator. Okay. And I still like to work on the upper extremity here too. Just because like the shoulder blades and that upper back is tight. Definitely want to still like work on, find
What
out
was
the tender
that?
spot.
Jeez.
That's all your wrist flexors.
Oh my gosh.
You got all the extensors out this way.
Yeah.
So, is that tender too in here?
Not as bad as the other one that you said. I was like,
Okay.
what the hell?
So, have you heard of tennis elbow?
Yeah.
Yeah. So tennis elbow is typically on the outside where I'm working right here.
Yeah.
Okay. That's not too bad. Now, golfer's elbow is on the inside. So it's all the flexors doing stuff like this.
I wonder if that's like I wonder if that has anything to do from switching from infield to outfield or anything. What do you think? Like throwing wise?
You definitely could. Do you put a lot of like spin with your wrist on the ball? Yeah. That's probably what it would be from then. So, actually, that's a good correlation. I've never heard of that before with like pitching or throwing a ball like that.
Yeah, because like when I was in college, I went from shortstop.
You get some more pops here.
I went from shortstop to second, and like just the way that I would like rotate my shoulder was different, so it like really hurt my scapula.
Okay.
Because I used to go up and over. With this one, I would go up and over for shortstop, but for second base, I would go sidearm.
Yeah,
so
you
it just
see that quite a bit more with that.
So this and then this would be here, right?
Mm-hmm.
Okay.
So the idea again is tennis elbow is the extensor, so doing
here.
this, right?
Mm-hmm.
Now golfers elbow is going to be the inside, so you're doing everything inside.
So I wonder if that's like batting too.
Yeah, probably batting as well.
Over the top for like baseball and softball.
Yep.
That makes sense.
So little things like that. Kind of want to work on know the biomechanics of how that happens, but unfortunately, like when we have wrist pain, it's typically actually because of the muscles surrounding our elbow, surprisingly.
That's interesting.
Yeah. Yep.
Fran arms. It's a good thing I didn't come like Tuesday.
Why?
We just did Fran, which is just like a stupid 21-15 night of pull-ups and thrusters, and like after I do pull-ups, like my right here is so tight.
Is it?
So I guess waiting a few days was
That's good. It just means I would have beat you up more.
Mm-hmm.
And you'd probably start crying again.
Yep. my right eye did.
There you go. I'm gonna give you a little pull here. I know you just like adjusted your fingers too.
Apparently not well.
Okay. Yeah, and your wrists seem to move pretty well.
That's good.
Alright. Gonna do a couple more things here. So this is a gua sha. It's a jade stone for actually scraping out tissue.
Okay.
Alright. I'm gonna have you just bend your knees for me. I'm gonna start on the left again so you know what I'm kind of doing.
Okay.
Is anything tender when I do that? Not too bad?
No.
Okay. So I mean I just have to push harder?
No, thanks.
I'm still going to try to reset the knee and hip there too. I'll give you a little ankle adjustment too. So we want to work on the biomechanics of everything. Like we were talking about before, how your knees kind of come in. Yeah.
Down into the spot too, yeah.
Okay. Yeah, so it's more of that medial quad, but it's not because I'm poking on it or pushing here, right? Okay. That's the other hard thing to do is stretch out these quads, especially the medial, and like favor specific parts of the quad. You know, we always hear like the classic pull your heel to your butt type of thing. It's not always the easiest thing to do if your knee's bugging you.
Yeah, because that's the knees. Like when I pull my foot back to my knee, that's when it like puts you a lot of pressure on the knee. That makes.
I'm just gonna give you a little push here, okay? There you go.
What was that?
That was money. That's what that was. Wowza. That was actually amazing. So we're just resetting that knee joint here. So
oh God.
Again, try to melt best you can. One more. Okay. Yeah, you were a little guarded for that one.
Yeah, I was a little nervous.
Yeah. Is that okay on the left side?
Yeah, the left one was fine. I feel like I was scared on the right one.
Yeah. So again, it's okay. We're just trying to get everything moving. So there was again.
My hip. That was my
your
hip. Yeah.
Jeez Louise.
Snap crackle.
Everything's a little poppy here. Okay, so I'm gonna give you a little pull here. You might feel a little separation in that hip, okay? So we're resetting that. So just relax best you can. There you go. We're getting everything moving.
It's all working.
Again, if we're working on the whole biomechanics of every joint, everything is gonna be able to move more freely. So same thing here. Let everything just melt as best you can. Good.
Yep.
A little more subtle there. That was good. All right.
Get the new fresh kicks in there.
Yeah. These things are fresh and white, that's for sure.
So red.
How do you keep white shoes white?
I wore them to school today too. I was like, if one kid steps on my foot, you're failed.
Don't tell Opie because he'll definitely step on your foot. Okay, try to melt in here best you can. Let everything just relax. There you go.
Oh my god.
You okay?
Yes.
That was
I was
perfect.
not expecting that to happen though.
Same thing on here. On this side, just relax. There you go. A little more subtle on that one.
Yeah.
And we actually got a little more separation in the
I
hip on
did
that
feel,
one too.
I felt like there was 2 there for sure.
Yeah, good stuff.
Yeah.
Yeah, so this knee is definitely, everything adjusted really well, but this one did not quite want to move, especially when I did that little knee flexion. But yeah, you can just feel how crunchy that is.
So crunchy.
So what I would say is, the best thing for you now is to keep loosening up that medial quad. Try to ice that knee as much as possible. Get that inflammation down.
Okay.
All right, as long as it doesn't make you like
Hives.
burst out in hives.
More hives. I already have enough.
But come on up and tell me how all that feels as you stand up.
Okay.
We got a lot of stuff to move today.
Yeah.
So as long
everything. I don't think
Yeah.
anything didn't move. Oh
as it was pretty amazing. Talk about all the bubble wrap.
Yeah.
So again, we got that subtalar joint in your ankles to move.
Yeah.
Kind of resetting that. It's going to allow for some more plantar flexion, dorsiflexion, more range of motion in there. When I get that extension, that hyperflexion in the knee with that adjustment, it's opening up that joint space to allow more mobility in there, separating the hips.
I can't really see you.
Oh yeah, that's right. You gotta see. I'm just like a gray blob here. But again, getting all that moving is just helping the whole biomechanical chain of your low back.
Okay.
How does the level of your pelvis feel? How does your low back feel?
My low back feels good.
How is like the upper back, neck?
Neck feels good. It's a little crunchy still, but
Still crunchy?
Yeah, but still it feels better.
That's all right.
Ankles feel good.
You are just a crunchy person.
I think I am.
Yeah.
It's not good.
And it's not. It's okay. It's not a bad thing. You're trying to keep things
Call me
moving.
Captain Crunch.
Tell me how that feels walking out. Do you always put your purse on that right shoulder as
I
well?
do.
Yeah. You ever try putting it on your left? I know it feels kind of weird, but we want to think about things symmetrically like that. Yeah. How does that feel like walking out here? Does it feel okay on the knee?
Yeah.
You're standing like that? Do you feel the pressure on the medial side of the knee?
Not standing, no.
Okay.
Did you hear that?
Yeah. Was that your ankle
That's
or what?
my left knee.
That's your knee now?
My left one.
Everything is.
Ew, I know.
Everything
How I
is
make
just
myself
open.
stop cracking is the real question.
It's like
A release, right?
yeah.
Okay.
And it's good. Again, as long as you're allowing the joint to maintain its normal range of motion, you're getting that popping. That's okay.
Fair.
But typically, it's just tendon snapping over bony structures. That's all it is. So
Not actually bone cracking.
no, not necessarily. So when you pull apart like your joint spaces, that's essentially creating a negative pressure within the joint space.
Okay.
And that's where you get that bubble that pops. So
Got it.
it's a little different here and there, but
Cool.
since it's Friday, I do recommend that you come in like early next week so that I can at least like follow up, give you a couple days over the weekend to see how everything kind of settles
Okay.
with the adjustment, and then after that we'll see how that knee is kind of like progressing.